Hello, this is Dr. Paul Cottrell, and I'm recording this on 5/7/2026 at approximately 1:10 p.m. This is a publication showing researchers developing a monoclonal antibody to neutralize the Andes hantavirus infection in vivo. Now, it's important to understand that hantavirus, human-to-human transmission, is the Andes virus. Now, some key takeaways here. You have researchers in Chile, Germany, and also the United States through the Rocky Mountain laboratories. So the Andes hantavirus is an etiologic agent of the hantavirus cardiopulmonary syndrome, or HCPS, a severe disease characterized by fever, headache, and gastrointestinal symptoms that may progress to hypotension, pulmonary failure, and cardiac shock that results in 25 to 40% case fatality rate. Currently, there is no specific treatment or vaccine. However, several studies have shown that the generation of neutralizing antibody responses strongly correlates with survival from HCPS in humans. In this study, we screened 27 Andes virus convalescent HCPS patient sera for their capacity to bind and neutralize the Andes virus in vitro. So basically, what they did was they had patients that were having this HCPS. They had the Andes virus, and they were taking their blood sera, their blood, and seeing if they could neutralize in vitro the Andes virus. One patient out of the 27 showed high neutralizing titers from their sera, and it was selected to isolate the Andes virus glycoprotein antibody. So one of the 27 had a high titer level that could neutralize in vitro. Now, the Andes virus glycoprotein specific memory B cells were single cell sorted. So they they took the memory B cells from that patient. They single cell sorted, and there was a recombinant immunoglobulin G antibody. So the IgG antibodies were cloned and produced. Two monoclonal antibodies, the JL16 and the MIB22, potentially recognize the Andes virus glycoproteins. So that's the GN and the GC proteins that we talked about in a previous video, and neutralize the Andes virus. We examine the post-exposure efficacy of these two monoclonal antibodies as a monotherapy or a combination therapy in a Syrian hamster model of the Andes virus-induced HCPS. And both monoclonal antibodies protect 100% of the animals with a lethal challenge dose. Now, it's important to know that the Syrian hamster model was developed at Fort Detrick to do these types of studies on hantavirus. These data suggest that the monotherapy with the monoclonal JL16 or MIB22, or a cocktail of both, could be an effective post-exposure treatment for patients infected with Andes virus-induced HCPS. So the big takeaway here is that back in 2018, there seems to have been shelved a monoclonal antibody to the Andes hantavirus. This is important because that is the suspected version of the hantavirus that's causing the problems that we have today with human to human transmission. If you would like to support the work that I do, please donate on my website, the-studio-reykjavik.com. All these videos I do are for free. It takes time to make these types of videos. And if you could help support the work that I do, I greatly appreciate it. You can donate through Stripe, PayPal, or buy me a coffee. You can be a paid member to my Patreon channel. Please share the links and follow my different social media accounts. All the links are in the description of this video and all my videos. And take a look at the products that I have on my store. They're very high quality. Please go to my store, the-studio-reykjavik.com. Thank you for listening and have a nice day.